safe, quick, and highly effective. I'm honored to welcome our speakers. We have Alicia Spoor, Doctor of Audiology. Alicia is President of Designer Audiology, located in Highland, Maryland. She received her Doctor of Audiology degree from Au.D University in Washington and a Bachelor of Arts from Michigan State University. She has a very broad experience with working in, prior to opening her practice, she was part of the cochlear implant and hearing aid teams at Mayo Clinic, Arizona. And she is past president of the Academy of Doctors of Audiology and the current legislative chair of the Maryland Academy of Audiology. So we are very proud you can join us, and Alicia will share her experience using the EarWay Pro. We also have Yael Carlin. She is the CEO of EarWay Medical, and she has a track record of more than 20 years in the medical device industry and started world bringing products from concept stage to the market. And about myself, I have 12 years experience with Sonova, also in other industries, a few more years than in the hearing aid industries, but 12 years with Sonova, leading a global function. And now I work with EarWay Pro. For the last 2 years, I see it as a very important and innovative product, and we will see how relevant it is also for the clinics and clinicians. Our agenda today, Yael will quickly share the mission. She is with EarWay Medical since the very beginning. Then I will take over to describe a bit the problem or lay out the magnitude of the problem. And then we head right into the EarWay Pro, the solution, product training, experience sharing, and the key elements for successful procedure. And we will have time for a Q&A.
Thank you, Martin. So EarWay Medical started basically, came up to Dr. Amir Khater, who's a serial entrepreneur and working out of Israel on multiple startups, and actually asked him to come up with an invention for her patients coming in to the clinic with wax and her having to dig for 20 minutes with a curette and the patient being extremely uncomfortable. And basically, when Amir heard that, he's usually working with biomaterials. He told her, man, I'm sure there's a solution out there, either than a curette and the microsection that have been there for a while. But when he went and started checking, and I joined him just over 5 years ago, we realized that there was little to no innovation. And this is actually how EarWay started, from a real need in the market. And our idea now is to bring products that are validated through the healthcare community and accepted to really simplify everything that has to do with ear care solutions. Martin, I'm gonna give you back the description of the problem. Martin? All right. I see that, Martin, something happened, so I'm going to go into the problem. Basically,
I'm muted.
Here? Okay. All right.
So when working with one of the leading hearing aid manufacturers, it was to me always clear how the relevance of the earwax in clinical everyday life. But looking at it more systematically, discovering that 60% of older adults suffer from earwax impaction, 5% of the healthy adults, and 33% of people with development disabilities. That's a huge number. It is more than we may experience in our clinics on a daily basis. And earwax is the #1 reason for treatable hearing loss. So very often, and we know this in the clinics, we see patients, they come in and it is about the earwax, the hearing loss. It's impossible to fit the hearing aids with the presence of earwax also to perform hearing tests. So we have to remove it. It's the earwax is between us and the successful treatment. And there are additional symptoms like tinnitus and pain and discomfort, dizziness, vertigo related to earwax. And we see it also looking at from a consumer or patient perspective. There's a huge demand, 5,000% increase in the Google search terms related to earwax removal. That was 2020. And looking at it from a more clinical perspective, it is treatable. It's not something, how can I say, it's quite easy to remove, one would say. It is, in general, it is a healthy substance. With the current solutions that we use, they all require extended training and practice time. Very often the instruments need to be sterilized and generate aerosols, and they come with long chair times, which trigger then the disruption of patient flow, so rescheduling, dropouts. And that's one of the consequences, the potential patient loss to other providers or to other systems. And we cannot show the competence that we want to show to our customers. And in the COVID times, this has all been highlighted. If we cannot provide the earwax removal, we are losing the patient, or we can't even see the patient because we have to remove the earwax. So much about the issue which is known by clinicians. Now we talk about the solution.
One last,
One last.
Yes, just one quick note, please. Everyone who's not on mute, I'm not managing to mute it from my control panel. Could you please mute yourselves? It's disturbing in the background. Thank you.
And it is the number one reason, the earwax is the number one reason for functional hearing aid issues. Right? That's from a survey, April 2020, with more than 350 clinics participating in the US.
Yeah, so functional, not fictional, as you might have seen the typo up there. This is bringing us to the solution. I think it's first and foremost, as it's a gray ground, and we have participants today here from around the world to really precise the indications and licensure. The product, the EarWay Pro, is indicated for the removal of cerumen from the external auditory canal. It is aimed at occlusions and partial occlusions, and it's intended for use by professional healthcare providers and physicians who are licensed or certified to extract cerumen from the auditory canal. And this is really depending on the legislation in each and every country and geography. So we're not going to drill down into that, but we know that you will make sure that you're covered under this specific law and regulatory aspect in your country. Going down into how this product started, it was very important for us to have a product which is sustainable long-term in the market, is based on clinical evidence and acceptance of the professional community. We developed it with ENTs, audiologists, and other professionals together. And then we took the pathway of a clinical study that we will share in a few minutes to really test the safety and efficacy of the product. We keep ongoing feasibility testing, and we're now at the stage that we're actually expanding and reaching out to the market with audiologists and HCPs, as we found that you are the ones that are in the biggest need, as Martin just described before. The clinical study for safety and efficacy was done in Israel at the Kaplan Medical Center, 59 ears, 46 patients. And it was our first generation product. So if some of you know the product today, and we will go down into the features, it wasn't as soft and it wasn't coated with silicone. And yet the results were very, very good in the matter of the success rate, which was standing at 86.4, and 3 patients only that had mild irritation, which we can see with any other product removing wax. And I think the important point you can see on the bottom, it refers to the median time of treatment, which is 30 seconds. So once you pass a learning curve, there's a very quick procedure which you can perform on your patients, save the chair time, and continue for the real purpose that your patient is there for, providing the full aspect and treatment. We also held a feasibility testing specifically with the Au.D group in the US back in February. The intention was that each one of the 5 professionals will have 10 patients, but unfortunately COVID came along and we needed to stop with the clinics shutting down. However, we did have quite amazing results for the first 18 patients, 21 years. We were using the EarWay Pro sizes small and medium, and it turned out that the large size is fairly needed within the American population. And the interesting point is the duration of the procedure. Even for the first very few patients, already you can see an average was under a minute. We know that the left ear is always a bit longer for the right-handed audiologists and healthcare providers. In terms of success rate, we see that the right ear, again, had a bit of a higher success rate, but we had very nice results even before passing the recommended learning curve of 15 to 20 patients. And the impressive thing is that the product was immediately accepted as a very safe product due to the features that we will introduce in a few minutes. So the EarWay Pro, the product has 6-7 years of R&D behind it, and we still are constantly improving it based on the feedback coming from the market. There's a grip handle that enables you to really hold it and that it wouldn't slip through your fingers. We have a helical head that has an open profile. What does an open profile mean? There's no cavity in the middle. There is a cavity. The product is not closed. So it enables engulfing the earwax once going into the canal and grabbing the plug as one piece. And then when you pull it out, it comes as a whole. The flexible neck enables the navigation in the canal between the bends, and some of them are more tortuous, as we know. And the markers are the indicator for safety, the distal and the proximal. They're based on CT scans done in Europe and in Israel, and they're the indication of how far you are from the tympanic membrane. The feature that we added after the clinical study was performed was silicone coating. The silicone coating is actually cushioning the helical head, and when it's introduced against the canal walls, it's softer, and especially in the part of the bony canal or over the bends, it's giving a more agreeable sensation in the ear of the patient. The product itself comes in 3 sizes in order to really fit the different canals that you're meeting in your everyday practice. It has all the regulatory approvals, so FDA, CE, TGA Australia, Canada Health, and the Israeli AMAR. And the company, EarWay Medical, is an ISO 13485 approved for quality assurance. The products, as I said, are clinically tested with ongoing collection of data. I'm going to walk you now through step by step. Can you see my screen? I hope so. I'm going to walk you through the procedure itself. Again, the features you can see very well here. the open cavity, which enables the engulfment of the wax, and the flexible neck, the 3 sizes. This is very important, and we'll touch how to choose a size. Basically, when your patient comes in, obviously examine the ear and see that there's wax inside. We had already HCPs that were so excited that they forgot that there was a hearing aid inside the canal. So please take that measure and step. And then choose the size. This is a very important point that Alicia would describe a bit more in detail later. But the idea is that it sits comfortably at the entry to the meatus, the entry to the canal. And the thing which is different from your intuitive approach is to always size 1 up so that we're ensuring this engulfment. Here we're taking the medium size. Always straighten the pinna posteriorly and superiorly. This would straighten the canal, and then the product would move smoother inside. It wouldn't meet these bends, and the procedure would be more comfortable for you and evidently for your patient. We have the distal and proximal markers, which you have to follow. When you start inserting, start prior to entering the canal. This would really give you the feeling between an empty canal and once you're latching on the wax. You will feel the difference, and your patient will also get used to feeling the helix turning against the canal walls. What you need to watch is obviously the patient's face and the 2 markers. When the first marker is aligned with the entry to the meatus, stop for a couple of seconds, have a look at your patient's face, see that they're comfortable, and the recommendation is to continue to the second marker, the distal one, in order to ensure that you've latched to the full plug. Then, once you're there and it's aligned, turn 360 on the spot and pull gently and very slowly out without turning the product at all. So these are the steps. And I am going, Alicia, to give you the stage now to share your experience and guide the participants of the webinar.
Perfect. Thank you, Yael and Martin. So as mentioned, I am an audiologist in the United States, so I can speak a little bit to my experience and some of the tips and the tricks that you'll see as we go through it. So Yael just did a great job showing you the video overview, but obviously as licensed and certified professionals, when somebody's coming in, we can't just jump to taking the wax out of their ears, right? Doing otoscopy is great too, but we also need to make sure we continue with those thorough case histories so we can identify any contraindications to either the wax removal or use of the EarWay Pro system. And we do have those contraindications, so we'll show you that a little bit later on a slide, but it's very similar to all of the contraindications that you've already been taught as you go through a license or a certification program. Really important, just like it is with any other cerumen removal system. Ideally, you want the patient to be seated in a stable position. I tend to do that upright, although I know some people prefer to have people lying down. And you want to counsel the patient as to what's going to happen. Just like any other procedure we do, the more the patients know what to expect and what's coming, the less fear and kind of reaction that they're going to have to it. So when I seat my patient, I always have them put their head back on my headrest, and then I tell them what's going to happen. So I will pull out an EarWay Pro if I think I'm going to use that. I will pull out a curette, a specula, whatever it might be, and you just show them. And if it's going in their ear, they can touch and feel. Because it's all their anatomy and their their oil and skin that would be on it. So if you can show them and they see it, they have a much better idea of what's going to happen when you go through this procedure. Obviously, you're going to judge the diameter of their ear, just like Yale said, and it is very counterintuitive to, if you're making a clinical guesstimation, if you're not sure, to go one size larger. So a lot of times I look in a patient's ear, an adult patient's ear, and I think, oh, they're medium size. Through my learning curve, I would start with the medium size and I wouldn't be able to take out all of the wax, and I would still end up having to go back in to clean up some of that blockage that wasn't removed. If you look at their ear and think, I'm not quite sure if that medium or the small is going to encompass the entire thing, go one size larger. And again, it's soft, it's flexible. If the patient can touch and feel it, they know what's going to happen. And it just does a better job on a single pass as opposed to having to do multiple ones. When you brace, it's very easy because you're doing the same bracing as otoscopy. So yes, I'm right-handed, so the left ear does take a little bit longer, and I always start with that ear when I'm doing bilateral removal, but it's the same proper bracing that you're going to have. And again, we have a picture and a video to show you that. Yale mentioned this really well. You're going to start when you input the EarWay Pro, you're going to start and you're going to be twisting it. I twist mine clockwise because I'm right-handed. So when I start putting it in, you're starting to twist that process clockwise, and then you're going to insert it to that second marker like we just said. The trick is you twist to go in, but you don't twist coming back out. So again, the video was really great in showing that, but you have to kind of learn twist in, pull out. Again, a little bit different with some of the things we do in the other procedures that we have in audiology. So if we go to the next slide, you'll see the bracing and the position of the patient and the audiologist's hands, although I believe this is an ENT that's doing this. But you can see, right, we've still got the bracing on this right hand. You're still pulling that pinna up and back, but it's easy for you to see the patient's face if they start grimacing at any point in time, if they have that natural reaction of you're going in your ear and it's like, right, stop and tell them what's going to happen, let them see and feel that again. But it's the same, again, the same bracing technique. Whether you're twisting or when you're pulling out, you still want to be bracing on both sides of that procedure. So this is a really neat video. You will see this is almost a camera like on the end of the EarWay Pro, so you can see what it looks like. And I think the really neat thing about this is I call it a corkscrew. You can see that corkscrew going in and engulfing the ear canal. And one of the reasons why we say that you want to size up is when you look at this video, you want that corkscrew to encompass that entire external auditory canal. So if it's a little bit too small, you may not be able to grab all of that cerumen. Oh, that's so satisfying to me. All of that cerumen that is around that patient's ear. So that's why if you're not sure, you really want to size up and make sure that that corkscrew is going all the way around as much of the external auditory canal as possible. And then again, any of us who are doing cerumen removal, that's a super satisfying picture. And the patients think that we are fantastic because now maybe we've just cured tinnitus or hearing loss or dizziness or pain or anything else. And I do like to show my patients what I pull out of their ear. But that's, again, super satisfying to me. So a couple of things that, again, you can start to use to be successful using the EarWay Pro. There is a learning curve, which I think is important for a lot of us to keep in mind, because when you've been working with patients for 5, 10, 20, 30 years, sometimes we forget that the very first time we did a hearing test or the very first time we took cerumen out, it was not a fast, easy process. We had to work our way up to it. So what I have found is that you really need about 15 to 20 patients of using the EarWay Pro to feel entirely comfortable and proficient with what you're doing, not only from sizing the ears to actually the movement, the twisting, the pulling, and taking it back out. Obviously, as much as you know of your patients and whether they're new or established, if you know that they have a normal ear canal, start with those patients first. So if you have somebody that's coming in routinely for cerumen removal and you know that you've taken it out successfully using some manual instrumentation originally, start the EarWay Pros on them because you know that you've done this successfully, you know your process that you go through, and it can just help you be more confident that you're not going to run into something that's unexpected with a new patient that you may or may not know. Obviously, healthy adults who will sit down and hold still and pay attention are always better than with adults that have any type of mild cognitive impairment, which is the seniors with MCI. The kiddos are obviously always going to be much more difficult. So if you have that quote unquote ideal patient to start with, the first 15 to 20 times, your life will be a lot easier. You'll build up your confidence and work a lot faster. We all know that taking cerumen out is complex. There's no right or wrong way. Everybody's going to be different and every ear canal is different. So sometimes I get that really difficult ear on the left side and I just kind of cringe like, oh, I still have to do this on the right ear, and I go to the right side and it's a piece of cake. The ear canal's a different shape. It's maybe a little bit bigger, whatever it might be, it just becomes much faster and easier. So don't pigeonhole a patient based on one of their ears as well. Obviously, the type of cerumen, which we are also going to go through in just a minute, will make a difference. Go back for a second. I apologize. We'll come to the cerumen type in a minute, and the patient's tolerance to pain. So you can always ask them. In the US, we're really big on using different types of inventory measures, but you could easily give them the pain scale of like 1 to 7 and say, what's your normal tolerance? And if they say 1, you might need a lot more counseling to take the cerumen out. Or if they say 7, I have a very high tolerance for pain, then you might say, great, this is going to be no problem for you, or this will be minimal problem. I would never say no problem. Again, patience and practice. I can tell you, and Yael can attest to this, I did my couple and I did my few and I was trying to get it. And the first patient where I sized up, I had that ear, I felt confident, and I twisted it and I pulled it out and I felt like Rocky. I was like, yay, I got it. It was super rewarding. And then it was very addictive because now I had felt that I was proficient and I could start to get my confidence now that I knew what I was doing and how it felt and how it was working. And so it did become very addictive for me because I like that instant gratification, and so does the patient. And then I think one of the other things that can be very helpful, especially to audiologists in the United States, which I can speak to much better than professionals in Europe or in other places around the world, we want to be working to our highest scope of practice. And so this is something that can bring in additional revenue. These can bring you additional patients. If there's a 5,000% increase of people who are looking for this type of service and you're able to offer it and proficiently remove it, especially in a very short time frame, it's just an added bonus to you. It's access for the patients and it's affordability for the healthcare provider. So if we go to the next screen now, everybody can see the different types of earwax. And if we've been doing this, we probably know there's a huge variety all the way from the left-hand side, the soft one, to the runny one. So starting on the right side, anytime somebody has very runny ear wax, it's much more difficult to go in and grab it and pull it out in one bit, because if it's runny, it's just going to fall through that cavity, or the corkscrew as I call it. So you do have to judge some of that when you look in. I think the other thing to point out is the ones that are hard compact, the ones that are crumbly, and even the ones that are hard and thick. Also easy to use the EarWay Pro, but you will often need to soften that ear or kind of condense that earwax into more of the soft or the solid formed, because that's what's going to work best with the EarWay Pro. So if you have, I don't know where these are approved everywhere. I use earwax MD often in my clinic. I use Debrox in my clinic. I use sometimes a couple drops of oil, clear, soft oil that can go in and actually soften that type of wax before I go in and pull that out. So if my cerumen removal is only taking me a minute on each ear, I might have to wait 5 minutes by the time I put the drops in, let it sit to actually be effective, and then take the wax out of their ear. But if that's the case, I've got a couple minutes on both sides, 1 minute to remove the wax, thorough case history. Again, you can still have these patients coming in and out the door easily in 15-20 minutes with that type of procedure. Don't hold me to those numbers. Everybody's unique, as we know, but it can be a much faster process than oftentimes somebody thinks it's, half an hour, 45 minutes. So I can't stress this enough, and I think Yale did a great job. This is so counterintuitive to size it up. So when you look at the ear, if you're not sure, I would highly recommend starting a little bit larger rather than a little bit smaller, because again, we want it to encompass the entire ear canal. It's got a flexible head. It is silicone coated. And so when you touch and feel this, and the patients touch and feel this, they can feel, look, this is moving, this is wiggling, it's soft. Yes, there's still plastic, but it's got that soft coating on it. So it's the risk of damaging the ear is going to be much less using that type of system. So you can size up, and then if you need to, you can always work back down. But I guarantee if you start a little bit smaller, you're going to end up having to go back in and either clean it up in some other way or using a second device, a second EarWay Pro, to get the rest of that from the entire canal wall. This is another great picture that in video that kind of shows the encompassing of the wax into the ear canal cavity. I do not have one of these models in my clinic, but you can see at this point that corkscrew is all the way through the wax. So when you pull it straight back out, again, a much easier way to do it, because you've gotten the corkscrew all the way into the end of the piece of wax, or in this case, maybe it's a piece of ear mold impression, because that's a pretty pink bubblegum color. So contraindications, like we mentioned before, obviously any type of otitis media, especially in the external auditory canal, this is going to be a big red flag. So you should be asking about history of ear infections, current ear infections. You can see the third one down, we have active PE tubes in place. You want to make sure that we're not going to do any damage. If they're a cold water swimmer, that there's no polyps or anything that might be in the external auditory canal where we could do a little bit of damage. It's soft, it's flexible, but we can still do a little bit of damage with that. If they've had history of ear surgeries, especially on the TM or cochlear implant, any type of surgical modifications, that's clearly something where you want to refer to that surgical center, or you want to have that thorough case history and that approval from that surgical team before you're going in and doing any type of removal. History of radiation to the head and neck area. You just think I'm faster than I really am, Yale. History of radiation to the head or neck. You don't know how that's changing, not only tolerance to pain, but any type of anatomy and physiology. And so that's a red flag as well. Obviously, anomalies of the ear. So this is, again, is a very easy question to ask the patient on an intake form if there's any ear malformations. Those who don't know what it is, the answer is no. Those who say yes know very well exactly what it is. And then any malignant ear or temporal bone issues. So I always say that when I start with the earwax Pro system, print off kind of the 6 steps for the procedures, which I started, that was my first slide, and then you print off your contraindications. And if you can kind of use those 2 systems, you're going to be pretty successful as you go through your learning curve. I think the pictures of all the types of wax are fun for patients too, because as you can see, you know, when you pull wax out using a curette, you're going in a lot of different times. You know, it's lots of different places. If you're pulling it out and it falls on the patient, right, you've got something to put the wax on and then it ends up falling off because it's dry and crumbly or something like that. That's a big cleanup mess and the patient can sometimes get squirmy, but when you pull it out with the EarWay Pro, it's often self-contained, it's a one-time system, and you can show that patient, look, this is what was in your ear. And I would say the majority of patients like to see and know it, because then you can talk as that provider and that expert. What do you do to minimize this? How often are you coming back in to see me? What are products that you can use to help help me do my job better, but also help prevent that blockage in system that you've had in the past? So I'm an entrepreneur. Not only do I like to clean ears, I also like to sell products that can help clean ears. So that's another revenue stream as well. So the tips are very similar to what we just mentioned. I am a big advocate of counseling the patient. I think the more you counsel on whatever you're doing, the better success you're going to have and the better buy-in. People know why you're doing it and that you start to become the expert in that area. The stable positioning, we talked about the sizing. The bracing should be very easy because you're using exactly what you're using with otoscopy, and it is essential in this procedure as well. I do love my loops. Thank you, Dr. Chaikin, who's on this phone call, for introducing me to those. I think that the lighting system really gives me some more confidence, especially at the beginning, but it's certainly not essential. And so it's one of those things that you may want an extra fluorescent light. You may want an operating microscope. You may want loops or a headlamp or something to help you at the beginning. Once you do, I would say 15 to 20 ears, you really get the feel of it down. And so the lighting doesn't become quite as essential, but it can be more comfortable. And again, proficiency, we talked about, aim to do 15 to 20 patients, and I guarantee, well, I almost guarantee that you will feel extremely confident doing what you're doing. The last thing is to a clinic. So we've talked about, you know, kind of the audiologist, the ENT, the healthcare professionals role of it. But when it comes to clinic, it can have a huge impact on your clinic to be doing cerumen removal. Not only are you working to your full scope of practice, and we're saving, you know, the very complicated cases for the ENTs who should be working to their full scope of practice as well. And sometimes that includes cerumen removal, but it's also a great continuity of care. So as Martin was saying earlier, you know, when those patients come in, and that HHTM study showed us that when patients come in, if wax is truly the problem, then if we can take that wax out and move them to the next phase, whether that's testing, whether that's hearing aid fitting, whether that's, you know, continuing with amplification, whatever it might be, not only is the patient happier, they stay within your practice, but they're more likely to continue on to the next thing. They're not lost to the system, and it's a very timely thing. So it doesn't take an extra 45 minutes to go through this process. It really takes an extra 5 or 10 minutes if you're already doing a case history and you're moving on to that next type of treatment or testing process. Your ear cleaning can turn into a lot of other types of procedures. So I can't tell you how many people come in because they think they have wax in their ears and they don't. Or they do have wax in their ears, but as soon as they start to see all the other things that are available in the office, whether it's a picture on the wall or a model, or they just come in and they say, "Do you do hearing protection?" Well, of course I do, right? Do you do music earplugs? Do you do in-ear monitors? Do you do hearing testing? My mom, my dad, my sister, my brother, my son, everybody's got a network. And so if they can turn to you as that expert, sometimes you can help that individual person with additional revenue generating procedures and products. And sometimes it's their outreach in their bubble of people that can come to you. And sometimes it's both, which is even better. So it can be a big benefit to offer this. And I've mentioned lots of times additional revenue, nobody's going to turn down additional revenue. So the cost of the EarWay Pro and keeping it in the office is very minimal compared to not only charging for cerumen removal, but then also any of these other types of things, the maintenance products or solutions that you might be using, and those additional appointments that you're going to get from that patient when they come in. So with that, we have this great patient testimony, and I won't read it to you. You can all read it here. But again, that's a very satisfying picture for me. Of a person who can really benefit from the EarWay Pro, not only as the practitioner who maybe doesn't want to clean this person's ears all the time because it takes forever. And you can see they said it lasted over 20 minutes to half an hour, and now it's much faster using this new product.
Yeah. If I can just add, this was one of the very first patients that the ENT who approached Dr. Kreitzer was really basing her case on. And she gave him as an example. And he was one of the first ones to try. And this is still a prototype. As you can see, it's in this transparent kind of whitish color. There were no markers, but we did prove that the product was working. And he was so happy that he wrote this note. So absolutely. Alicia, thank you very much for sharing your best practice and all these great tips and tricks, because we do know that there is a learning curve, like with any new medical device, and I believe that your indications are on the spot and extremely important to shorten the learning curve and adopt the product into the practice. Just to touch a few of the benefits of why you as audiologists would like to basically try out the product and then introduce it into your daily practice. Definitely there's a quick learning curve. We're talking about 15 to 20 patients at the most. The low is cost. There's no sterilization. There's no basically anything that has to do. It's a one-time product, disposable. So and it only takes a 50-minute to 1 hour webinar like today. And if you want to expand, we can refer you to some further online removal, earwax removal courses that we're working with. The product is very safe. It's empowering your employees that might not always, if we have some clinic owners here, might be a bit, not very confident in taking this leap into starting to remove earwax due to current procedures, enduring the time and then the risks. So there is a very low risk of complication, a very low complication rate. And we sold up to date over 100,000 units. And as we said, the things that we could see in very rare cases, as in the clinical study, are really a bit of irritation in the ear canal. And the product is tested. It is highly effective once you pass this learning curve. So we're talking about if you apply the right wax, the right patient, and the right size, you should be at around 80 to 90% of success. And we hear more and more, especially in COVID days, with cross-contamination and infection control, trying, to reduce the chair time of your patient in clinic and avoid sterilization or droplets, that this is becoming in an audiological clinic the go-to product. And the procedure obviously is improving significantly your chair time and enabling a one-stop shop. Alicia, you just shared with us a patient that came in due to tinnitus. I would love you to share this story with everyone here.
Sure. So I actually have a better one. I saw a patient yesterday, came into the clinic, and he said, you know, my left ear's plugged. The right ear's fine, but my left ear's plugged. I have hearing loss. I have oral fullness in the ear. I have tinnitus in the ear, and I get dizzy. And that's how I know that it's completely occluded and needs to be cleaned out. Well, turns out this happens every 3 to 4 years, and he just needs somebody to go in and clean it out for him. So not only did we talk about management systems, how often he needed to see me, so we didn't get to tinnitus and dizziness and fullness and hearing loss. We can tackle it beforehand, but also that there's a product. But when we went in and when I went in, took it out, it was a very easy process now that he was my 20 plus patient that I've seen. Go in, take it out, and pull it out. And it's like instantaneously, I'm fantastic because I can cure him of all these things, but just instantly he's like, oh, no, I can hear, I can, you know, I can feel again. My ear feels normal. It feels like the right ear. The tinnitus is gone. I don't feel dizzy. All of those things associated with it. And it makes me look great because of that. But my other recommendation to him is, you know, after I did my thorough history with him, I said, you know, if you haven't had a baseline hearing test in a while, you're getting to the age with the noise exposure you're telling me, we really need to do this. And so he's scheduled to come back next week. So not only did he be cured from, not only was he cured from his cerumen, you know, he bought additional products to help prevent the cleanup. He's seeing me in 6 months again to check those ears, and he's coming back for a hearing test. So it's kind of the whole package in one, and it was very fortuitous that he came in yesterday.
Yeah, fantastic. Thank you for sharing that. I want to open actually for some Q&A because I'm conscious of the time and we have 10 minutes left. There was one question in regards to foreign bodies. And I have to say that the product is not indicated for foreign body removal. However, we do have documented cases of mainly ENTs that went in what they thought was earwax and turned out to be the bud of a cotton swab. So this has been documented a couple of times, but this is not the indication for use of the product. I'm happy for everyone, if you have any other questions, either to write them in the chat or if you wish, open your microphones and okay. Anyone else? Another question that I see as coming up is in regards to blood thinners. I want to address this with you, Alicia, and then I would provide my answer.
So, number one, based on state licensure law, if you are able to do that, you need to be very comfortable taking cerumen out of patients' ears first and foremost. So going through the training and the learning curve and taking not only a webinar like this, but maybe also a hands-on webinar that can give you some other tips and tricks. When it comes to blood thinners, I know that it's a variation of different audiologists as to what they feel comfortable with. So my first indication is that when my students come through, if the patient is on any type of blood thinner, we probe into that medication, how often they're taking it, what is the dosage, who put them on it, why are they taking it, things along those lines. If it was a one-time situation and they haven't taken it, it's a benign point. If they are actively taking blood thinners, I personally don't let my students take wax out of their ears, especially in the very learning curves for that. I myself am comfortable, and again, with licensure law, I'm able to do that. If I have any thoughts or hiccups or anything just doesn't quite feel right, or I'm not sure of this patient because I haven't seen them in the past, I will refer them on to an ENT due to those blood thinners. So that's true regardless of if I'm using an EarWay Pro, manual instruments, irrigation, or suction. But that's why that thorough case history is so important, is because if I don't ask about the medications, I won't know. And so making sure I've asked all those medications and have that documented is very important. So Yale, what do you
Yeah.
say?
To our answer always is really that there are two schools. This is what we're seeing. There's the audiologists and the healthcare providers that would remove it no matter what, and it depends again on the legislation in the country, and also drills down to whatever the regulation is within the clinic or the chain and so on. And there are the others that are more conservative and would say take the bit more of the secure approach of either referring out to an ENT or asking the patient to put drops for a couple of weeks and then come back and wash it out very carefully. I have to say that with the EarWay Pro, even with blood thinners, we did not get complaints. So, and we know for a fact that there are users, there are audiologists which are using the product, and they actually find it less invasive and less of a risk. So there's another question, and that would be maybe one of the last, in regards to how much you're charging for the procedure with the EarWay Pro.
If any of you know me, I'm going to give my exact same answer. I would take your hourly rate and multiply it by the number of hours or partial hours that you intend to see that patient. So that's going to differ in every different country, city, state, etc., based upon what you need as a clinician to stay in practice. So again, the product itself, Yale, I don't know if you want to go through costs of that, but the product itself is very negligible in that cost. And so when you're seeing a patient, it's really going to be that chair time. And obviously, if you can see them in 15 minutes for chair time, you can see more revenue coming in than you would, or faster than you would if you were seeing them half an hour.
Yeah, so my question just before my answer to this, I think it's coming and I'm not sure. Linda, I saw that it's coming from you, and we can discuss this later offline. I know that in some countries, they're charging more for the show and the theater of microsuction. And sometimes people say, but the procedure is so quick. Why should I charge? How can I justify the price that I'm taking? And the matter of fact is, when a patient comes in, especially these days, and we're getting this feedback from the market, they just want the earwax out. They want the problem to be solved as fast as possible and out of their clinic to their safe cluster home or environment, which is COVID-free and solving what they stepped in for. So we know from audiologists across geographies and across the world that they're basically charging the same price as they would for someone stepping in for an earwax removal if they only provide only earwax removals. So I hope this answers the questions. There's any chance to incorporate a light into the EarWay Pro? I use Bionics and find the light helpful on the unit. Basically, the EarWay Pro doesn't have a light with it now. This is why we have the distal and proximal markers. Alicia, do you find that more than a headlight or loops, is it necessary during your practice?
I do not find that. However, I feel like when I used to use the Bionics that you mentioned with the light tip on it, after I got the feel of it, I wasn't using that light hardly at all. And I'm not using the lighted Bionic system as much anymore. I do prefer a pair of loops or a microscope because I think it gives me better control. But that's my own personal opinion.
Thank you. I think it's just one sec. I'm checking. Okay. So I hope this answered the questions, and we are happy as we're running out of time. You can send us obviously an email or on LinkedIn, send us just any further questions to us or directly to Alicia. I'm sure Alicia, you'd be happy to answer. We're very happy to share with you today that our partners Ditech, E3, and Sunnybell Supply have pitched in a promotional code for starting the year. And we will be sending out this presentation. So wherever you are in the world, and in Canada with Ditech, it's Ditech 2021. For E3, the E3 shop, it's EarWay 2021. And for Europe, Australia, and New Zealand, it's Sunnybell EWP for EarWay Pro 10. So these are basically